This is a very important question or sort of set of things. I feel like what probably parents don't realize, or is surprising to hear, that we start discharge planning on the day the baby's born. So baby comes into the NICU. We have weekly multidisciplinary discharge planning rounds. That's exactly what it's called. It's run by our discharge planner or our discharge coordinator. We start anticipating the baby's needs right away. Again, this depends on what their needs might look like down the line, because they came with this congenital heart disease, or they came very early, like 4 months early, or they have a brain issue that we have to take care of. Whatever that is, we kind of start anticipating that literally on day one. In these weekly meetings, we talk about the need for follow-ups, referrals, we need for different kinds of medications, particularly the ones that need prior authorization. So we have them there before, well before discharge, so we're not like delaying discharge in any way. We talk about the equipment needs, what challenges we're facing with getting these equipment, and what the timeline will look like for the equipment based on the different insurance companies and other things. And in addition to that, the discharge coordinator actually starts meeting the family periodically to sort of set them up for what this is all going to look like. Hey, your baby's going to go home on oxygen, and he's going to go home on a feeding tube. So obviously we want to make sure your home is set up for all this, to make sure the power doesn't get shut down in your house, or you have a backup generator when you need it, if especially a baby's going home on a ventilator, for instance. And they talk about, different kinds of medications that need to be given, the referrals that are going to happen. We also try to set them up if they have many different follow-ups that are going to be ongoing for months. We actually try to get them into what's called a medical home. The medical home then coordinates these visits in a way that they're not going every single day to some visit, but they're able to bunch visits in a particular day or two in the week. This way, there's a little bit of, sense of normalcy for the family. So it's a very, I think it's the toughest job to be as a discharge coordinator in an NICU, because you're anticipating the needs of the team, you're anticipating the needs of the family, and potentially what challenges, you face in the community as well.